Okay, I'm Alan Moses, and I'm a dentist in downtown Chicago. My office is in the Sears Willis Tower, and I teach at Rush University in the Department of Sleep Disorders. I have invented for sleep apnea and snoring the Moses sleep appliance. And to do the Moses sleep appliance, we use a technique for taking the bite. It's called manual muscle testing. It's registering the relationship between the maxilla and the mandible, which is key in dilating the airway to the largest dimension that we can get for solving the problem of apnea. And so, using this bite technique of manual muscle testing to find a position of strength, we found that having got there, all muscles are stronger, and we have strength and we have the largest possible airway. So we thought we had something pretty special that would be applicable in sports as well. Ergo, I came up with the Moses Express, which is a sports appliance for increasing performance, increasing strength, and breathing better. Those are some wonderful, things to say about any sports mouthpiece. And so, to show you how to do this, I've asked Maricela Ramirez to be my assistant. And so, the technique we use for registering the relationship between the maxilla and the mandible, the manual muscle testing. To establish manual muscle testing, we need two positions. We need inhibition and we need facilitation. So first we ask Maricela, does this shoulder work, and are you in pain in either shoulder?
It works.
They both work. And so we're going to test deltoid muscle. This is called isometric deltoid press, the technique we're using. I'm going to push down, standing up straight, looking straight ahead, lips together, teeth slightly apart, and tongue in the roof of your mouth. I'm going to push down, you're going to resist. Ready? Resist, resist, resist. Okay, this is a 1 to 3 second push. We don't need to have her break, because she knows the resistance and I know the resistance, and it is a mutual agreement. This is measurable, and we could do objective measurement with a dynamometer, and we have done it. But this is almost or as accurate in my mind. Okay, so now clench on your back teeth, Maricela, and resist again. Ready? Resist. Okay, not nearly the resistance. So I know facilitation, which is the least amount of neurological clutter possible. I know inhibition, which is the neurological clutter from presumably 28 to 32 teeth, all touching at the same time, and muscle activity of a clench. So now we're going to show we show the clutter. Let's do one more demonstration of clutter, and we're going to have her step on just what looks like a paper towel bundled up, wadded together, folded, and we're going to do this again. Lips together, teeth slightly apart, tongue in the roof of the mouth, and resist. So we now know, step off please, what inhibition is and from neurological clutter, and we know facilitation, which is good resistance. Now we're going to try to find a position of ultimate resistance. And so to do that, we have a bite wheel, a bite stick, bite guide wheel. And this bite guide wheel has 9 different sticks, 3 different vertical dimensions, 3 millimeters vertical, 4 millimeters vertical, and 5 millimeters vertical. Then it has 3 different dimensions of protrusion. Protrusion is the lower jaw coming forward. And so we have it edge to edge, upper over lower, and then we have 1.5 protrusive and 3 protrusive. And these numbers are indicated as 300 is 3 with no protrusion, 3015 is 1.5 millimeters of protrusion, and 3030 is 3 millimeters of vertical, 3 millimeters of protrusion. The numbers are easy to figure out, and it doesn't make any difference. It's easy. If you do it without even knowing, you can tell. So we start out, we're going to do the 3 millimeter, and we ask her to bite on it. But when she bites, I want you to close your lips and keep this stick parallel to the ground. So now we're going to test again. and tongue in the roof of the mouth, lips together, standing up straight just like before, and I'm going to push down. She's going to resist. That's okay. There was some facilitation. It was not as good as rest position. Now we're going to go to 4. Well, first we find vertical.
400.
400 is 4 millimeters, no protrusion. And so I'm going to push down, you're going to resist. Ready? Resist, and it's much stronger in that position. So we go to 5. 500, and then we test. And so, ready? Tongue in the roof of the mouth, standing up straight. Resist, 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 resist. Okay, that's the best. 5, and you agree, 5 is better than 4. Mm-hmm. Now we look to see, is 500, no protrusion, better than 5015, 1.5 millimeters of protrusion. Okay. And that's it. And so we push down, and you're going to resist. Hold it up there and resist. Okay, 500 was slightly better than 5015. That's the one we're going to use. So this is a breakaway stick. I break away 500. The others you can discard or save. And so now we're going to give her this one. I'll tell you how we're going to do. We warm the mouthpiece. I want you to hold this in a hand, and then when I put the mouthpiece in, I will initially put it in, and then I will have you bite down. I'll tell you when to bite. You will bite into this in the grooves. Okay. So here's our device. This is the Moses Express, and the closed trough goes on the bottom, and this connector goes on the lower, and then the upper teeth are going to bite in here. And the reason this is so important is because with this in position, we have the biggest airway possible. So airway is important, and we take up as little tongue space as we can, so we have the most room for the tongue, the biggest airway, and airways are important for breathing. The more room for air to get in, the better we function in sports. So we heat the water to 180 to 185 degrees. If you have a thermometer to measure the temperature of the water, that is the best. If you don't, water typically simmers when you start to see slight bubbles coming up. But sometimes when you see the bubbles, it can get up to 190, 200 before it boils. We want this at 180, early, light simmer. So if you have a thermometer, this is the best. But we have the thermometer, we have a hot pot, and so we are going to put this in the hot pot for 1 minute. And we're timing this. And then when it's done, we will take it out and put it in her mouth, as you will see. So I'm going to form it for you, and then you're going to put this in and bite on it. I'm also going to push to get it in the lips. The beautiful part of this mouthpiece is if you miss, you do it again. You can't go wrong. You can do this virtually as many times as it needs. We've done this 6 times to make sure we got it right. And it's as good after 6 tries as it is after 1. Don't feel stupid. Don't feel you did something wrong if you don't get it right the first time. Often we want to do a second just to make sure it's more snug, more secure, and a better fit. So we shake it off, hold it to make sure it's not too hot, and then place it just a second on the lower, push down, and close. Put that in, bite into it all the way. Make sure it's in securely. Push in with the cheeks on the side. Push out with your tongue. Suck. Create a huge suction in your mouth. Pulling your tongue into the roof of your mouth, tongue against your lips. Let it set about 30 seconds, 40 seconds. Take it out and run it under cold water. So we check it out. We see nice indentations of the upper teeth. We see nice indentations of the lower teeth. This looks pretty good, so we'll try it in. We can give it to Maricela, say, try it in, and show me. Now, I would prefer that this fits snugger. If you get in close, I would prefer that this is more snug against the outsides of the teeth. I would like this fitting tighter. And then the other thing we could do, look, is open and close. It's got a little bit of pop, a little suction on the lower, but I think we can do this a little better. So, and just to show that it can be done twice and 3 times, we'll repeat it. Now the great thing about this is, again, all sports in the past have not needed a mouth guard. But with this mouth guard, I feel that we're enhancing strength, we're enhancing breathing, and we're enhancing strength of the neck. As soon as we get this fit right, we'll demonstrate neck strength. So, 1 minute. Always this has to be in the water. 1 minute. Timing is everything. And always keep your eye on the thermometer. We use a candy thermometer. That's our 1 minute. Shake it, feel it, put it back in and bite, and this time we'll push a little more firmly against the sides of her teeth. Close. Now this is not anything mysterious that you can't do with a friend, a parent, or a relative. This is something that anyone can do, and now you felt, if you're watching, she had very, very good suction on the bottom. Run it under cold water. Check it out again. She puts it in, and we look again. Much, much more snug on the sides. Good job. Okay, so next, I want to demonstrate an increase in strength. And so what I want to do is I want to test again just to make sure we've got it. And again, when you muscle test, you can use any muscle. I like deltoid because I'm an old man. I'm not very strong. And so I could test a lot of people with this. Most people, even Maricela, if I were saying, Maricela resist and I'm going to push, she's stronger than I am. Or Maricela, I'm going to pull and she's stronger than I am. So I get the nice long lever arm here, and she's got a healthy shoulder deltoid muscle. Okay, so I'm going to push down and you're going to resist. Ready? Mm-hmm. Resist, resist, resist. And this is way better than it was before with just a bite stick in there. Okay, so now another test here. Because it's very important, athletes in sports have a strong neck. And so we're going to demonstrate. So I want to push, and I want you to resist. I'm going to try and rotate your head. Ready? Mm-hmm. Resist. That's pretty strong. And now rotate in the other direction, and she's pretty strong. Next, let's do this. Back to the wall, and I'm going to push. Okay, ready? Resist, 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 resist. That neck is very strong. Now take it out. Now you can go back to the old facilitated position here and just lips together, teeth apart, tongue in the roof of the mouth. Ready? Resist. And you see a huge difference. And then I'll clench on your back teeth, and it's like mush. Which says if you don't have a mouthpiece in, try not to be clenching when you're going to get hit or when you're going to be stressed. Put this back in. And we did this one. Okay, open. Now, lips together, teeth apart, tongue in the roof of the mouth, and resist. Oh, don't turn your body. Okay, resist and resist. If you want to try this again, clench, just to see the difference. It's huge difference. Thank you. There's your mouth guard. Beautiful. Okay, so now, here's the other thing. The concept is mouth guard for any sport, because with this mouth guard, we increase strength, we increase airway, and she can take a drink of water and talk. Say, please. So the point is, you don't see this when you're drinking water with any other mouth guard when it's on the upper and taking up a lot of space. Very easy to swallow. And give me a few sounds. Say your name, please.
Marcela Ramirez.
Okay, that's as clear as she does it without the mouthpiece. But Maricela, you say to me, His House Church Zebra.
His House Church Zebra.
Okay, so she's legible. And the point is, you can talk with this, and you can take a drink of water with this. It's comfortable. Neck is stronger, and muscles are stronger. So we're going to check it out again, and I have a feeling that when we test this, and we're looking for you to test this as well, I think we'll find that there's a lot of things. The performance in general is better. And we'll have a discussion of all this on our website.